Okay. Hello everyone, my name is Alexis Vega and I went to Kendall Sports Medicine. Here I shadowed Dr. Bernstein. The reason I came here was because he was the only doctor on the list, and fortunately for me, it was the best decision ever. I will be graduating in fall of 2025. I will be pursuing physician assistant. Here we have the next one. Kendall Sports Medicine is an outpatient podiatry clinic that specializes in podiatric sports medicine, foot and ankle surgery, trauma, orthopedics, and custom-made orthotics. Dr. Bernstein no longer does reconstructive surgery or joint replacement, but he does do outpatient procedures such as anesthesia to cut ingrown toenails, and other things such as corticosteroids. They are open from 7 a.m. to 6 p.m. on Monday, Wednesdays, and Fridays. I came in Monday, Wednesdays, and Fridays from 7 a.m. to 12 a.m. Here's the site layout. This is the lobby to the building. And this is the entrance into the building, into the clinic, sorry. This is the waiting room for all the patients while the doctor gets ready to evaluate them. This is the sign-in sheet for them. Here on the left, first room is the evaluation room. They sit down right there in the brown chair. He does have two modes to evaluate them. This is an ultrasound, which he uses to see any soft tissue damage, such as ligaments, tendons, and muscles. Here on the left is another room where he comes to evaluate the MRIs that he sent them out for when the two modes of evaluation that he uses are inconclusive. Here on the left is the x-ray room where he takes x-rays of the foot to see if there's any bone damage, trauma. On the right is the computer where he sees the images he takes. He himself does the images. Here we come out into the hallway again. There are two rooms where he puts patients when the big room is too full. Here's one of them, his office right here. The second room for the patients when the big room is too full, which is this one right here. There are 4 chairs, 4 tables. Each one has a ultrasound, shockwave therapy, and e-stim. Usually the massage therapists that work here do it, or us when we're not evaluating with the doctor. By evaluating, I mean just looking in the room while he does it. These are 2 whirlpools which he uses the patients for ingrown toenails to treat it with Epsom salts. As you can see, there are a lot of memorabilia that his patients do send to him, as he is the UFC and Miami Heat multiple sports teams podiatrist. Here are the hot packs that we put on the patients. We put in the microwave. This is the little break room for us, the bathroom, the stuff that his athlete patients send to him, and the office. Okay, my experience with Dr. Bernstein was fantastic. I wouldn't want it any other way. I learned how to evaluate patients and how to talk to them. I learned about multiple diagnoses and how to identify and treat them. I learned how to read x-rays. Didn't learn how to do ultrasound very much because the doctor said it took him years and I wouldn't really learn it in the 3 months that I was there, even though he did teach me a little bit of ultrasound. When no evaluations came in, as I said, I would help patients with e-stim, ultrasound, and hot packs. Overall, I was extremely happy with my choice and would change nothing. I did at the beginning come in late, at around, let's say 12 to 5, but I soon learned that he did his evaluations in the mornings from 7 a.m. to 2, so I would come from 7 to 12. For future students, I recommend they refresh on lower limb anatomy such as bone, ligaments, tendons, to have a leg up when evaluating with the doctor.